Okay, let's look at water-soluble vitamins. In addition to the 4 fat-soluble vitamins, we also have water-soluble vitamins. There are 8 B-complex vitamins, as well as vitamin C, that are considered water-soluble. There's some differences between the water-soluble and the fat-soluble. You can see that water-soluble vitamins easily dissolve in the water, and they are absorbed into the bloodstream. There's limited storage, unlike the fat-soluble, and so we need to make sure that we're getting adequate intake of all the B-complex and C vitamins on a daily basis. But because of that, there's little concern in terms of toxicity. They are easily destroyed. They're very delicate, so whenever you're cooking, you need to be careful how you're cooking the product. Improper handling, heat, light, exposure to air can destroy the water-soluble vitamins. And so when we're working with fruits and vegetables in particular, we want to make sure that they're handled gently, they're stored properly, and they're not cooked to excess in order to preserve their nutritional value. Water-soluble vitamins are also coenzymes. And what that means is they are small molecules, and they're going to bind to an inactive enzyme. Once bound, they'll cause that inactive enzyme to become active. So if we're lacking any of the B vitamins that are needed for an enzyme to become active, then you don't have that process occurring, and you can see deficiency symptoms that occur. And then the bioavailability is also important. And bioavailability means the amount of that vitamin that can be absorbed and available to the body. And most of the water-soluble vitamins have a very high bioavailability. So between their ability to be absorbed and the little risk for deficiency, most of us can get all of the water-soluble vitamins that we need if we're consuming a healthy diet. So let's look at the different water-soluble vitamins, and we'll start with the B complex. The first B vitamin, B1, is thiamine. Thiamine is a coenzyme, which means it's important for the release of energy from carbohydrates. And thiamine also works with enzymes to promote metabolism of glucose. And that's important because, remember, glucose is the major source of energy for the brain and the nervous system. If there is a deficiency of thiamine, that deficiency is called beriberi, which translates to I can't. We don't really see that in developed countries, but in countries where polished white rice is a major staple, beriberi is fairly common. And again, remember, toxicity is rare, so unless somebody is taking a supplement or a multivitamin that's extremely high, we're not going to see any type of toxicity symptoms. The second B vitamin, B2, is riboflavin. And again, riboflavin is a coenzyme used for energy metabolism, and it's necessary for certain vitamin and mineral metabolisms, and is also known as an antioxidant. If we see a deficiency of the riboflavin, it's called a riboflavinosis, and it has a couple hallmark symptoms that we look for. Symptoms include glossitis, which is inflammation of the tongue, and cheilosis, which are cracks around the mouth. And somebody who has a riboflavin deficiency also is very sensitive to the sun, and if it progresses, you might notice some confusion that is occurring. Niacin, which is B3, again a coenzyme. So you can see a pattern here. The vitamins, almost all of them are coenzymes. In terms of the niacin, it releases energy from carbohydrates, protein, and fat. And it's found in different forms. It's found as nicotinic acid or nicotinamide. If we have a deficiency of niacin, the deficiency is called pellagra, and pellagra translates to rough skin. It's also known as the 4Ds. So if we're not taking in enough niacin, over a period of time, the deficiency symptoms occur. You're going to see dementia, diarrhea, dermatitis, which is the rough skin, and eventually death. In developed countries, again, a deficiency is pretty rare. However, somebody who is an alcoholic and they're not eating but rather drinking their calories could develop pellagra. Niacin can also be used to help treat high cholesterol levels, but one of the side effects in terms of taking a high dose of niacin is flushing, because it causes an increased blood flow to the skin, and it can also cause headaches. So that's something to keep in mind when you're working with patients who have cardiovascular disease. If their physician puts them on a niacin supplement to help lower that cholesterol level, you want to make sure it's a non-flushing brand. Otherwise, they're going to start coming in and complaining about feeling hot, the flushing, and the headaches that occur. Other B vitamins that we're briefly touching on are pantothenic acid, biotin, and B6, which is pyridoxine. Pantothenic acid is a component of coenzyme A, or CoA. It's important in fatty acid production and also for the release of energy from our energy-yielding nutrients. Biotin is important in the production of glucose and fatty acids and DNA synthesis. And then pyridoxine, again, for protein and amino acid metabolism, as well as the production of white blood cells and hemoglobin. And something to keep in mind with the vitamin B6, if there is a deficiency, B6 is important in immune function as well as the synthesis of hemoglobin for our red blood cells. So if we have a deficiency of the B6, we're not making that hemoglobin. And the hemoglobin is important because the hemoglobin carries the oxygen throughout the body. So a deficiency would then result in a type of anemia called microcytic hypochromic anemia. So if somebody is diagnosed with that, you know that they have a B6 deficiency. Sometimes we also see weightlifters who will take in excess amounts of B6 because of the protein metabolism, and the thought process is, if I take in more B6, I'm going to be able to build more muscle. Not the case. You only build muscle through exercise and through hard work. Yes, you need protein, but we get adequate amounts in our diet, and we get adequate amounts of B6 in our diet. So for somebody who is supplementing it, you could see issues in terms of hand and foot numbness and irreversible nerve damage. So that gives us an overview of some of the B vitamins. In the next section, we're going to look at folate and finish out the rest of the B vitamins and vitamin C.